So dear friends, hello and welcome back to my channel. My name is Panayotis Georgiou and I'm an ENT consultant based in Cyprus, trained in Germany. This channel aims to deliver to you high-yield ENT topics in a short format in order for you to be able to memorize the topic. Today we're talking about toxoplasmosis and Toxoplasma gondii in ENT patients. Let's go see the topic. Now, if you like the content, like and subscribe to this video, and much appreciated will be your comments on the video quality and how I can improve my videos. Now, for the toxoplasmosis of the patients, as we can see here, the protozoan that is responsible will be Toxoplasma gondii. First, we need to check the pathogenic cycle of the protozoan. The oocytes of Toxoplasma gondii can be found in feline feces or under the nails of the cats. Less so, it will be a direct spread to humans from the cats, more so through contact with pig's meat or bovine meat that is consumed uncooked. And here we have some human ingestion of this meat. Now, this is about the pathogenic cycle. The duration of the disease tends to be from 6 to 8 weeks with high fevers and general symptoms, but do not forget, in immunocompetent individuals, it will be seen also with lymph node swelling. Either nuchal, supraclavicular or submandibular lymph nodes can be affected, and to diagnose it, we use the so-called Sabin-Feldman test. This is a complement binding reaction of antibodies that are in most cases positive. So 70% of the population will be likely positive to this test. But never forget, Toxoplasma gondii will be an opportunistic infection causing problems only in patients with a severe immunocompromised system, like AIDS patients that have a CD4 plus less than 100. Now, in the sonographic findings, we will see anechoic lymph nodes with good vascularity. We can send histopathology for these lymph nodes if we test them in surgery, but also good will be a DNA proof of the protozoan in the blood circulation using serum from the blood and a PCR reaction. The treatment, the anti-parasitic treatment for these patients would be pyrimethamine and sulfadiazine, SDZ and pyrometh. That's how I remember it. Pyrimethamine, pyrometh. I just remember this pyrotechnic drawing with a meth head underneath it. Now, in patients with AIDS and a CD4 less than 100, the CD4 count less than 100, we can see a couple of stuff. First of all, meningoencephalitis. Patients can be presenting with seizures, loss of vision, and also the typical ring-enhancing lesions in the brain. For you to remember, I've developed a mnemonic with the initials of Toxoplasma. So T, the transmission, will be undercooked meat first of all and cat feces, or transplacental. The oocytes are the infectious form of the parasite, and it can cross the placenta, causing congenital infections and congenital malformations. Don't forget that this is an opportunistic infection, usually seen in immunocompromised patients. It's a parasitic protozoan, Toxoplasma gondii, and usually in immunocompetent patient will be only present as a lymphadenopathy with some general symptoms such as fever. Most patients will be asymptomatic. That's why we see a 70% of the population likely to be positive in the so-called Sabin-Feldman test, and people or patients that are AIDS positive with a CD4 count less than 100 will develop seizures, likely to develop seizures, and the very typical characteristic of this disease for these patients is the multiple ring-enhancing lesions on the MRI of the brain. The treatment, the antiparasitic treatment that we talked about with A, and this will be pyrimethamine, sulfadiazine, and folinic acid. Thank you for watching. Like and subscribe to the channel if you like the content. I'm looking forward for your comments how to improve my videos. Thank you very much.